Let me teach you some important points from the PSM. So this is very important for your NEETPG or FMGE examination. So let's learn it. Human milk is deficient in iron. This is very important. Human milk is deficient in iron. But human milk has a lot of lactose. Remember lactose. Always remember human milk deficient in iron and vitamin C. It is deficient. But human milk has lactose. Epidemic dropsy. Epidemic dropsy is due to sanguinarine. It is due to sanguinarine. And these are from argemon seed. Argemon seed. And endemic ascites. Endemic ascites is due to pyrrolizidine. Pyrrolizidine, it is from the crotalaria. Crotalaria seed. Okay. Okay. Now antioxidants, always remember ACE. Vitamin A, C, E and beta carotene. Antioxidant vitamin A, C, E, beta carotene. Midday meal contains 75 gram per day per child. Midday meal contains 75 gram per day per child. Demyelination occurs because of the deficiency of vitamin B12. Deficiency of vitamin B12. And remember, this midday meal contains 1/3 calorie and half protein. 1/3 calorie, half protein. Vitamin D, the richest source is halibut liver. Vitamin D, halibut liver and cod liver oil. First is halibut liver and then cod liver oil. Vitamin D. Vitamin A, fish liver. Vitamin A, fish liver. Calorie in 100 gram breast milk is 65 kilocalorie. 100 gram breast milk, 65. Remember, 100 gram breast milk, 65 kilocalorie. But for egg, it is 70. Egg, 70 kilocalorie. And for breast milk, it is 65. Remember these two close values. 100 gram breast milk, 65 kilocalorie. Egg, 70 kilocalorie. Protein in human milk is 1.1 gram. Protein in human milk, 1.1 gram. First sign of vitamin A deficiency is night blindness. First sign of vitamin A deficiency, night blindness. Earliest sign is conjunctival xerosis. First sign, night blindness. Earliest sign, conjunctival xerosis. For pregnancy, this is actually the folic acid. Folic acid level. Folic acid for pregnancy is 400 mcg. For lactation, it is 150. But according to ICMR guideline, it is different. ICMR guideline, it is different, okay? Just remember, for pregnancy, it is 400. This one you remember. Pregnancy, it is 400 mcg. Folic acid required for pregnancy, you know. Otherwise, what happens? If there is deficiency of folic acid, what happens? There is NTD, neural tube defect. Remember. Now, human milk deficiency, vitamin C and iron. I already told you, human milk is deficient in iron and vitamin C. Next. Neat protein utilization. Neat protein utilization is egg. 100% protein utilization happens in egg. Neat protein utilization, egg. Calcium in pregnancy. How much calcium is required? 1200. Remember, 1200 required calcium in pregnancy. 1200 mg per day. 1200 mg per day. Hypervitaminosis A. During hypervitaminosis, what is the meaning of hypervitaminosis A? Hypervitaminosis A means vitamin A is required more in the body. That is called vitamin A is consumed more, and this led to hypervitaminosis. That led to increased intracranial pressure, increased ICT, intracranial tension, intracranial pressure is increased. Remember, hypervitaminosis A lead to increased intracranial tension. Egg yields, I already told you, egg yields 70 kilocalorie, but milk, 100 gram milk, 65. Remember, egg yields 70 kilocalorie, but 100 gram milk, 65. Heavy worker female require how many kilocalorie? 2850. 2850 kilocalorie. Some books it is also written 2854, but exactly it is same. So heavy worker female, whenever they give you heavy worker female, 2850 or 2854 kilocalorie per day. Poor man's meat, very important. Poor man's meat, pulses. Poor man's meat, pulses. And pulses are deficient in methionine. Remember, methionine. Pulses are deficient in methionine. This is very important. Sometimes they ask you poor man's meat. You can remember by the mnemonic PM. Poor man's meat, PM. And pulses are deficient in methionine. So PM. Next is linoleic acid. Linoleic acid is safflower. Linoleic acid is present in safflower oil. Safflower, not sunflower. Okay. Linoleic, and it is not linolenic. Remember, do not confuse. Linoleic acid, safflower oil. Linoleic acid, safflower oil, not sunflower. Safflower. Indian reference man, 60 kg. Indian reference man, 60 kg. Lethaidism is due to which chemical? BOA, BOA. Lethaidism, BOA, neurolethaidism. This is due to a dal. What is the name of the dal? Khesari dal. Remember Khesari dal? Khesari dal cause neurolethaidism. And this is not actual lethaidism, it is neurolethaidism. Okay, neurolethaidism, a kind of paralysis that occurs. So, neurolethaidism in the Khesari dal, this is occurred due to a chemical. What is the name of the chemical? It is BOA. Name of the chemical is BOA. Vitamin B12 requirement. How much vitamin B12 requirement? It is 1 mcg per day. Remember, how much vitamin B12 is required? 1 mcg per day. And for protein, the reference man, for protein required for reference Indian man, that is 60 kg reference Indian man. You know what is the reference Indian man? 60 kg. I told you this one. See, Indian reference Indian man is 60 kg. So protein required for that Indian man, protein required for that reference Indian man is also 60 gram. So this is 60 kg man, and how much protein? 60 gram. 60 kg man requires 60 gram protein. Now see, I told you already, I will tell you about the ICMR guidelines. ICMR guidelines for folic acid for pregnancy is 400 mcg per dl and lactation 150. Oh, that is, this one is ICMR guideline. According to ICMR, I already told you that means. So ICMR guidelines, folic acid for pregnancy is 400 mcg per dl, lactation is 150. But in general, folic acid require pregnancy, sometimes they give option like 500 mcg per day, and during lactation is 350 mcg. Okay, so you can remember these two values and these two values. So whenever they tell you about the ICMR guidelines, then you can understand according to ICMR guidelines, the pregnant lady requires folic acid 400 mcg, and during lactation it requires 150. But in general, you can say pregnancy it requires 500 mcg and lactation 350. So these two values sometimes in different textbook it is different. But remember, this 400 and 150 are more authentic values. Okay, 400, at least remember 400 in pregnancy. This one, folic acid. Now let us come in this one. For a heavy worker female, I already told you, heavy worker female it is 2854. Okay, 2854. Some books it is 2850. Heavy worker female 2854 kilocalorie for reference female. But for reference female it is 1900. Remember, for reference female it is 1900 kilocalorie. And whenever they give you option like soybean and egg, both are there, then you have to remember soybean has more protein than egg. This is very important. Soybean has more protein than egg. Soybean and egg, soybean has more protein. First 3 months of lactation, extra energy. How much extra energy is required for during the first 3 months of lactation? So after the parturition, first 3 months of lactation, how much energy is required is 350. Remember, 350 kilocalorie per day. Extra amount of energy. Extra energy 350. Poor man's meat, I already told you this mnemonic. PM. Poor man's meat, pulses and deficient in methionine. Cereals are deficient in lysine. So you can remember by cereals, cereals. So this L you can remember from that L, lysine. Remember, deficient in lysine. Everyday requirement of fiber is how much? 40 gram. Everyday requirement of fiber, how much fiber we require? 40 gram. And if there is 350 mg of iron, then how much it is absorbed? Always remember 350 mg iron, that means absorption is always 5%. Remember how much absorption done from iron? 5%. So what is the 5% of 350? It is 17.5 mg. So 5% absorption. If the question is a person has taken 350 mg of iron, how much absorption will he take? How much absorption will be there of iron in the body? It will be the 5% of 350, that is 17.5 mg. Folic acid for male, sometimes they ask you about male folic acid. Fa means folic acid. It is 100 mcg per day. Folic acid for male. And the last one I already told you about endemic ascites. Endemic ascites, pyrrolizidine. Endemic ascites is due to pyrrolizidine, which is from the crotalaria seed. You know, crotalaria seed, pyrrolizidine, endemic ascites. So for today, these are the points for PSM. Thank you. Keep watching. We are starting new series where we will discussing different kinds of points which are generally asked in examination. Keep watching and please subscribe this channel. Thank you. Have a nice day.